Medical gaslighting. Does every healer need to know to stop repeating the wound or to stop re-traumatizing the client that has faced medical trauma, maybe a lot of medical gaslighting? We often think of gaslighting in relation to, certain types of relationships, we can have partners that are maybe narcissistic and that gaslight us, or situations where we are gaslight at work or whatever. But a lot of people, overlook how much damage medical gaslighting does to the individual that is on the receiving end of that, and the consequences of that, what problems it can create for the client or the patient. And some of the things that, as healers, as therapists, as practitioners, or even coaches, some of the things that we can actually do unconsciously, they actually create further problems for the client, that actually make them, want to shut down even more, want to, kind of hold back, or, just not conducive for the client, and can make the difficulties that they've experienced, it can feel as if they are, repeating that same experience, or it can feel as if literally they've been re-traumatized. So I think it's, worth exploring what medical gaslighting is and giving you some examples, and then to see it through the eyes of the client or patient. And some of you will, recognise probably situations that maybe yourself that you've experienced, maybe to different degrees. So medical gaslighting is when, someone is often not believed. They're dismissed, they're not listened to properly, they get the wrong diagnosis, they may be treated quite badly about that. They can, common things, you see this a lot of women, unfortunately, through the years and through history. Women have received a lot of medical gaslighting. If you look at what happened in a lot of institutions and asylums, many women were put into these places, not just women, but that was, a lot of women were put in and labelled as crazy or mad, and they had certain types of medical conditions, or there could be other things that happened, but they just didn't get the right treatment, so they were basically classed as not right in the head, or their symptoms were not real. Often it was classed as mass hysteria. And we can think that's way back in history, but the reality is some of that still goes on. And even if you are a healer or a therapist or a coach, and you believe that all disease is caused by the mind, the body, that kind of approach, I would urge you still to listen to this video on some of the things that I think it's important to understand and to see through the lens of the individual that is on the receiving end of that. Because I think the problem is sometimes people just don't have a clue what that individual has actually went through, and they maybe don't understand the psychological manipulation and abuse that sometimes they have suffered. And when you are going to any type of healer, practitioner, wellbeing practitioner, whether that is a doctor, a nurse, whether that is a healer, a therapist, or even a coach, if that individual cannot provide a safe space and a suitable space for that individual and that individual's challenges, sometimes it can do the opposite. It can do more harm. And I know for me, for a lot of personal experiences, I've had a lot of things, some things on the extremist case of abuse, and not just, gaslighting, complete, real serious abuse. And then on the other side, maybe more subtle manipulation, that after you've had a lot of abuse and trauma and things, it's just like, it's almost like the last straw, or the thing that broke the back, was it the last straw that broke the camel's back, or, that kind of thing, or it can be the last, they say the last nail in the coffin. And what happens when that happens during a session. Now, none of us are perfect. I've always said this, as healers, we're always learning. But I do believe that the way a lot of healing modalities are taught and a lot of approaches are taught, there can be a lot of lack of self-awareness from the practitioner and lack of insight. And, also a lot of bias can be brought into the session that is unconsciously projected to the person. And I think it's really important to understand that. And at the end of the day, we're supposed to be there to provide a safe space. And if you're not providing a safe space, then you can really challenge, you can make it really traumatizing for the individual's nervous system. And sometimes you have no idea, what someone has experienced in any sort of trauma. And the last thing you want to be doing is reinforcing that trauma, right? So I'm going to talk about some things that I believe are really important and it can make a big difference no matter what your client is facing, right? So I think the first thing is to think about presence. When you are fully present with your client or your patient and you're fully with them, you're fully listening to them, you're not distracted, that your mind's not somewhere else, they at least, they're more likely to feel as if they've been listened to, right? Presence, and particularly if you are more grounded and still and calm, you're going to help the person feel more safe and calm. The last thing someone that has had any, in any sort of trauma, does get into help from, in any capacity, a doctor, a nurse, a health practitioner, and or a healer or anything, is going to someone who is anxious and stressed or has their own drama, and you're energetically projecting that out to your clients. I remember someone offering to help me something on another level, and it was a time I was going through so much physically. And I've been going through a lot of things medically, quite traumatic. And this woman's level of anxiety was so through the roof that I struggled to be around it. She was trying to be helpful, but it was actually just, it felt toxic to me because the level of anxiety was just, I was dropping my energy in many ways to match her anxiety. Being an empath, being an unruly empath, at times is something that I've had to, look at. But the reality is we all have wounds at times that need to be looked at, but sometimes we need, we have to obviously get to the root core of things, but sometimes we need a bit of salve. We have to put the fire out at the time as well, just to manage through. So presence is really, really important. And that also leads to the art of listening. Sadly today, we can have lots of opinions and we can want to project things onto people, and we don't always fully have that ability to really listen. If you are listening, you're just listening because you want to get your point across. If you're listening because you just want to use a certain approach, but you're not fully in that active state of fully listening to what the individual is saying and approaching your session with that view. Sadly, a lot of people go in to every session with a projection and an interpretation of the client or what's going on before they actually meet them, and that they're not in that space of active listening. And the space of being, actively listening, that in itself can be very healing for clients, because you find in this modern day world that many people are not fully listened to. There's almost a kind of narcissistic element has come on society, right? And it's all about me. So people, and in many of the relationships, feel very disconnected and not fully listened to. And they've not always had that presence or someone that's fully able to listen. So the art of listening is really, really important. The next one is really, really important to a lot of people that have been gaslighted medically or had medical trauma, is actually believing what they say. Now, what I mean by that is we can have our own interpretations of the cause of something, but, when we can come from a place of compassion and non-judgment, right, it's far easier to fully really listen and say, right, what is the person telling me? And being able to be open enough to believe their truth, right? Now, of course, there's certain modalities that we can challenge how the person views something, right? But if you go in right away with this having a very closed mind or only a belief about certain things, but you're not open enough to listen to that person's experience, you're not coming from compassion, you're not coming from empathy, you have your own agenda. So it's really, really important that we come from that you want to believe that what that person is telling you is their truth and their experience. And it's a believing that it's their truth and their experience. And having the respect for them to actually at least take account of what they're actually saying, not to be dismissive. Because people with, particularly medical gaslighting, have often spent a large part of a long period of time being unbelieved and sometimes about really serious things. And that's part of the trauma, and that, not being believed shuts them down emotionally. And you need to be able to show and demonstrate that you are listening, that you care, and that you have a certain, that you want them to be able to share the truth, not dismiss it, not kind of just put it under the table. And, you have to be able to do that at the beginning of the session to support them, right? And, and this is where it goes into what I've already talked about, is compassion and empathy. We've got a lot of compassion fatigue and empathy fatigue going on in the medical system, even going on in the healing and therapy system. If we just look at the last 6 years now, we're in 2026, and if you like, over 6 years, a lot of things that's went on in the world and society has put people in even more burnout than what they were suffering. And if we look at the, even here in the UK, I know a lot of countries in the same state, that the medical system seems to be on their knees. So medical professionals are dealing with a lot. They're dealing with a system that's very broken, it's very dysfunctional, and sometimes they've been asked to work in environments that are not really about healthcare. It's often just symptom management, and they're not always able to do, with the resources or maybe limits in time, what they really want to do. And that can create a lot of inner conflict and a lot of suffering for them, and it can lead to burnout and, as I said, compassion and empathy fatigue. And also, we see also, sadly, also people can get a lot of abuse, and that level of abuse can lead to obviously a disconnection in the heart and that lack of compassion and empathy, right? So one of the things that, I often ask a lot of healers and therapists who talk about when they've got compassion fatigue and empathy fatigue, there's different layers to it, and there can be different causes, right? And a lot of it is like burnout, lack of boundaries, those type of things, and sometimes it's like, if you're highly empathic, there's certain things as you are addressing your own wound, and then you're getting, you're learning more about yourself and you're building boundaries. But there also can be an element of, which I see a lot, I'm doing a webinar on this, and it's about, having the awareness to understand where your gifts are and where, your strengths are and where they're not. And particularly if you're self-employed and you're creating a business, you might find that there's actually certain clients that you struggle to have that same level of empathy and compassion with. to trigger you. And of course, it's important that you work on that. But sometimes it is better for you to understand that they are not the ideal clients. Often we can have far more compassion, empathy for people, for situations that we understand ourselves or we have experienced. And it's one of the reasons why a lot of people, their purpose is related to the experiences that they've had themselves. And often clients will also, people will often say that, people don't understand and they'd rather go to someone that's had that experience, because there's a level of empathy and compassion that is maybe not always there with other people. And I think it's sometimes important to, look and be honest with yourself to say, right, okay, is my, when do I suffer compassion fatigue or empathy fatigue or burnout? Am I in the right role? Recently it's interesting, I've met a lot of people who've told me that they realise there's certain aspects, they may be trained as healers or therapists or certain types of coaches, and a lot of them are all different. Have spoke to me, but a lot of them are actually changing jobs and not going to do certain things because they've realised that they too easily suffered from that empathy fatigue and burnout, that compassion fatigue, and they realised that they maybe had studied for a time and worked towards a long time, getting into this type of work, but then they realised it wasn't for them. And, take their hats off to them, the fact that now they recognise it. Now, that doesn't mean that I often find with people like that, and something else clicks, it's a slightly different role. It can still be in the healing and therapeutic roles, but it can be they're doing something different, or sometimes they end up being teachers or coaches or something else, or mentors. It's just the perspective, but they may not, the type of healing or therapy roles that they've already shown up in or studied, they realise that that's just not a right fit, right? And for lots of reasons, and that was a big lesson for me. There was lots of clients that at certain times when I was dealing with certain challenges, I realised it was a waste of energy. I was leaking a lot of energy. It was just so challenging, and I thought, no, this is not the type of clients that I am best suited to or I'm aligned with. So it has to be, we have to understand that as well. We can, sometimes we can struggle for lots of reasons, right? And we have to look at our own wounds, and that's part of, exploring the wounded healer within. Now, the next one is non-judgment. Now, I studied counselling, and one of the things that I loved about counselling is the amount of the self-exploration. I was a big into personal development, self-growth. So when I was a teenager, I've read all these books. And what I, got out of a lot of that was the deep self-exploration of self, of who you truly are, and but also how you think and how you think, how you believe and the way that you do things. Sometimes we're just so an automatic pilot. We all have traits, really fantastic traits. We also have ones that maybe in certain circumstances are not the healthiest or can really trigger ourselves and even trigger other people, right? But one of the things that when I one of the things that I loved studying, or I really, found really helpful, was when I studied more a person-centred approach and counselling, where that non-judgment and that compassion. And I do believe there's all different types. I've studied all different approaches for different things, and I think in the healing journey and on the therapy journey, even the coaching journey, there's some dynamics that are better suited to certain circumstances than others, and depend on what the problem is and how the person needs help to move forward. There's some situations that you will only support the healing process if you come from that place of non-judgment. If you go in projecting and you're going in with this, judgmental attitude in certain perspectives and certain clients, it can be re-traumatizing. And this is, I think this is where, when it's the healing role, and the therapeutic role can be very different from the mentoring, coaching and teaching roles, and it's differentiating what they all are. One of the problems in the health, wellbeing, holistic and spiritual sector is that most therapists and healers now are, trained in so many different things that what they don't realise is their roles are getting mixed up. And then in certain dynamics, we've all done it, where, you're interchanging from the healer role of the coach to the teacher to whatever. And that can be a wee bit confusing in certain healing environments now. So it's really, really sometimes important to discern what role you play in a certain dynamic, and having the discernment to know, is this session supposed to be about safe space? So for example, I've done a lot of inner child work, and I've done sell a lot of courses on that, and one of the things that I would always talk about was the importance of that first step in connecting with the inner child, and how it's important that the individual approaches that in a way that feels safe for them. One of the things that I noticed in the healing industry was lots of people teaching lots of things like inner child, and they haven't an absolute clue about trauma, the different psychological things about wording, how you word things, what you do to provide the safe space, and also some of the approaches that for some types of clients are actually not always helpful. I do believe there's a lack of good quality training in certain areas, and I do believe now, even though I've studied healing for over 75 years, I do believe that a lot of healing modalities should be taught over a longer period of time, and there should be a lot of things taught for safe and effective practice. I think there's a lot of naivety. It's not always meant. There's a lot of harm that's caused by just complete ignorance. And what I say, you don't know what you don't know, lack of insight, lack of wisdom. Sometimes it's just that excitement when you learn a new tool, you just want to share it. And there's a lot of people that will say, you can't do any harm if you do things with good intent. I disagree. I've seen it on different levels. So I think it's important, a lot of people now they do a couple of months training in something, or even a year, and they think they're an expert. And believe me, I've been studying in the field. I've studied healing, coaching, counselling, different types of psychotherapy. I've studied all different types of holistic therapy. I've studied lots of things. And I'm definitely still not an expert in, most of these areas. And, there's a lot of things, and I know I'm still learning. We're always learning. So, it is important to have that you're not judging the person, that you're leading with compassion, that you genuinely care, you want what's best. The problem is that, we're human beings, and even sometimes, you have kind of a new technique, or you're selling a certain approach, and you have your own personal agenda. You may not realise it, but you can have your own personal agenda of what the outcome is, and project that agenda onto the client. And for the client that's had a lot of trauma, any sort of trauma, that projection can be that can be damaging, and that that can come when you're bringing judgment, and you're not being fully present, and you're not coming from that caring compassion. When you bring into a session more compassion and care, that even if you do make mistakes, the person can genuinely feel the compassion. I've been in situations, right, where most people, there's a lot of things, and I'm going to write a book about it, but a lot of things happened that people would really not believe. It was just so bad, some of the things that happened to me. But there was also situations that may have not, on one incident may have just been small, but when you've had those incidents constantly happen to you and repeat to you, it's almost, believe this way, I could explain, being highly empathic, I've got more boundaries and stronger that way, but what I found hard was being so porous to other people's stuff. When people were projecting onto me, I was getting more and more confused, even though I was very intuitive and whatever. Was this element of being easily overridden by their stuff and by then really question my own reality and question my own intuition and inner guidance, my sense of self, which is, is very destructive for the individual. And I think the problem is that, a healer, we're there to hold space. We're never doing the healing. And we're only part of the space, but sometimes our judgments and even sometimes our ideology or the modalities that we're bringing in, if we don't have good discernment, they can do more harm than good. And I'm going to be going into this a bit more in my free webinar, The Self-Aware Practitioner, where I'll be talking about, how important it is for the healer, the practitioner, to actually know their gifts and their strengths, and how that can make things more powerful in a session and help people know what clients are best suited on the work they're supposed to do. And then maybe situations where they don't know why they've not got good feedback, or why they're not getting the results, and maybe situations they've not thought about that they're actually triggering with clients, right? Now, I'm not saying all triggers are bad. Triggers are, are things that teach us where they're wounded, right? And I do think, if you get lots and lots of triggers about lots of things, you need to look at these triggers, the triggers are there for a reason, and it's easy for us to blame everybody. I see also the opposite side. I see a lot of, which I think is very manipulative and it's very destructive. A lot in the healing industry will say, well, if the client is being triggered, it's nothing to do with me. Now, on one hand, I can see where they're coming, but the problem is that also gives permission for healers and therapists to go in unskilled, be manipulative and abusive. And some of the things that I've had clients tell me, that I've had people I know, other healers and therapists, what they have personally experienced is absolutely shocking, right? And what's supposed to be the healing industry, right? So this is really, really important. Now, part of, generally, when you're treating clients, it's also knowing what the client really needs sometimes, just to be understood. So obviously all these basic things, help you make sure it's providing a safe space, but also a safe space can mean the environment that you're in. Like, for example, for about 13 years, I have been suffering from extreme noise sensitivity that was common only for this year. It was like even vibration would go right through. And the interesting thing, it didn't seem to start sometimes in the ear. It was like, when I felt vibration, it would go right up through my body. And now I know what was going on. But some of the actual level of pain is reduced, thank God, due to some help, from some gentle upper chiro treatment. But I had went to another chiro who was a chiropractor who was a lovely guy. He was a really nice guy, very helpful. But what happened in that environment, I went into a situation where it was really, really noisy. It was more an open space where there was little kind of cubicles with, you all know what I'm talking about, with almost just little panels up. But, there was very noisy. So every time I went in, even though at the time some of the things was very helpful for some things I had, I remember one incident where I was so disabled by the noise. Noise could actually make me feel like literally like pass out and lose all control of what was going on, because I found out there were some structural issues and some major things pressing on the skull, pressing on the brainstem and things. But at that point, I didn't really know what was going on. And I remember one night when, it was an evening, and he came in, and I was literally trying to, I was holding on the bed, and my body was just, it was so overwhelming. The noise was disabling for me. And I could see the upset, because he's like thinking, God, what the hell am I going to do? And you could see that I was really, really struggling. But it was quite traumatizing for me, just being exposed to that level of, and it wasn't that there was all sorts of people, there was all sorts of noises, there was banging going on. And it was not, he wasn't able that night to give me a proper treatment because my body was not, it did not feel as if it was in a safe space. And I've had all sorts of situations where, that I've not even been able to articulate to doctors, because I remember one, situation where I had to go to the doctors, they couldn't come to me, and I was left in a waiting room with blaring music, and the person that was with me would not, ask for the music to be turned down. There was a screaming way, and the person left to do something. I ended up having what would be classed as like a non-epileptic seizure, and I was hitting my head off a wall. And what was the most horrific part of that? I was humiliated because a nurse passed me by, just kind of looked, and there was me hitting my head like having, some type of kind of seizure. It is a kind of non-epileptic, so you don't completely close your eyes and whatever, but you have got no control over the body. Being actually just looked at and walked away, and I was left in I was degraded, I was humiliated, I remember, feeling so vulnerable, and that was quite traumatic for me. I was also put in a situation where there was extreme noise, and again, a radio blaring before getting into a doctor's. And then a doctor being she was getting impatient because my brain was struggling, and it was taking me longer to articulate what I needed to do. She started shouting at me. Now, luckily, one of my family members were with me and went through the roof with her. This person, it took a lot for her to go through the roof because she's not that, she's not very good at maybe being, articulate and being assertive. But one of the things about that was those environments were not conducive for someone that had sensory challenges, right? And it's like, sometimes we don't think about the environment we're putting certain clients in. And, I remember, I used to teach meditation, and, outside, most for the last how many years it's been always online, but I taught meditation in schools, I taught meditation in community projects, but one of the biggest things when I went to organise the meditation classes was the importance of trying to have the right space. And there were certain environments that asked me to create, and I would think, and it turned out that even though I'd said, look, we need this, it needs to be warm, it needs to be this, it needs to be conducive. And honest to God, some of the environments that I turned up, so I started being more really specific because it was not conducive. The last thing you want to do is people in deep relaxation, and then the next thing someone's coming through a hallway or a room and making a noise, a rattling noise. Or I'll give you one example. I remember being asked to do something, and it was like a room in a library, and I was told that there was nothing really happening and people were in deep state relaxation, and the next thing in the next room someone started battering a drum, right? So you can imagine these are all things, and for people that maybe have a lot of nervous system challenges, that is the last thing that they want. And I know some of these things can seem more obvious. I think what we've got to understand is that there's a lot of different degrees to medical gaslighting. Some people have life-threatening conditions and they've been living with something that they know intuitively is really serious, and they've not been listened to, or they've had chronic health conditions and they're treated as malingers, they're treated as being lazy, they're treated being anxious and depressed, and no matter what you believe is the cause of that, in your opinion, if you're coming from a lack of compassion, a lack of care, and you're only you're only there to project your opinion, or just there to what you think is fix them, those subtle things can actually, because there's a judgment aspect to that, you're not coming from a place of compassion, right? So one of the the most basic things is, as I said, presence. Another thing is listening, actually active listening. And active listening is not just listening, but if you're not fully sure what they're actually saying, is actually repeating back to them, is this what you're saying? And actually being specific about what they're saying, not just jump to a conclusion of what they're actually saying. You know, because when people are going to any type of practitioner for help, they can be a bit nervous, or they don't want to over explain something, they're trying to condense it, and sometimes you can misunderstand what they're trying to say. So active listening is not just listen, it's listening to hear, not listening to hear what you think, what you want to hear. It's about listening and actually questioning and asking deeper questions if needed, right? And believing their truth, believing the story, what they're saying. Now, you know, we can all have an interpretation. There might be some other things going on, but if you do not start by believing what the person is saying, what they feel as if they've personally experienced, and what they're going, you've jumped the gun. And you can miss really, really important things. This is one of the biggest things that I had a problem with. And I'll give you some examples which might show you the seriousness. So I remember years ago, and I'm not going to say who the type of practitioner it was, because it would maybe give away who it was, right? But basically, I went years ago to someone that was helping me greatly with a particular issue. It was to do with, I was going to this person and they were helping me with something that would help me structure the body, and it was very different for the chiro and all that. It was something when I had a lot of real muscle weakness, I was struggling. Walking was a big in it, stamina was a big issue, and I went to this person and they did help me a lot. They were showing me ways of moving my body when I had a lot of fatigue, and I had been diagnosed with fibromyalgia, I had complete exhaustion, my muscles would shake, tremble with weakness. And this person was reteaching me how to build up certain muscles and use the muscles that are more likely to get less tired, and use the body in a certain way. It was very beneficial. But the person was studying some other things. Now, this person had at least a degree in the type of treatment they offered. So they were not someone that had just done a year's course or something, right? So they're quite standard, and they had a lot of different advanced training. So I trusted this person. And then the person asked me, I think I'd made a comment about something that happened to me. I went to the pictures with friends of mine to see the Titanic. And I remember I found it really, I over-identified basically with the people in the water. So I found it quite traumatising. And I remember a friend of mine was getting really annoyed because I was quite upset through the thing. And I was like over-identifying, you know, being in, as if it was me, it was in the water. And I had a big problem as a child, as an empath. You know, if someone hurt their foot, I would be feeling the pain, that type of thing, and I would over-identify with other people's suffering to a very unhealthy degree. So anyway, I had also had a situation when I was really young. I was about 13, and I nearly drowned in a pool in Spain. It was, you know, not a nice experience. So that certainly was coming up. And this person was studying hypnotherapy. So they asked if they could use me as like a kind of case study to, you know, I could try this on you and maybe help. And I remember the person, I actually, unknown to him, I had actually studied hypnotherapy. I had a lot of, you know, and sometimes people, you know, one of the things I found is a lot of people underestimated me, didn't know the amount of training and experience I had under my belt and insight. But anyway, he started to take me into hypnosis. He then forgot what he was doing and basically left me in the middle of experiencing like me having flashbacks of where I nearly drowned. And he basically took me out, but still in that traumatic experience, because he forgot what he was doing. But he'd also forgot to ask me and made assumptions about a few things that he'd made the wrong assumptions about. So then he kind of panicked, didn't really know what to do. And thankfully, I had quite some, you know, I knew some tools under my toolbox just to help me move out from that traumatic feeling at that time. And I had a certain level of awareness how I could help myself. But anyone else in that situation could be left with a lot of trauma and, you know, and more damage, right? I remember also someone I knew, another practitioner who was studying hypnotherapy, who took me through a hypnosis and then said to me, let's fix your broken brain. And, this is mind-boggling, even sometimes the language sometimes people use as well. Again, of course, we're all human, but one of the things that session was the amount of words that were used that were extremely damaging. And used to see this with visualization. People doing guided meditations and did not have any understanding about language, about the type of language that is supposed, is safe to use in that type of, form of therapy, And this might sound simple, but we're going to take this in a bit further. But what also happened was, I think this was the finishing point with this person. I let this person off with this session, but then when I was diagnosed, I had many years of being gaslit over a sight problem, which turned out to be a hole in my eye that nobody had listened to, would listen and believe me. A young woman, I was classed as neurotic, when it turned out that it was quite devastating, and it was quite a shock when I was told that they thought I was going to lose my eye. There was a large hole in the back of the eye pressure was right down to 2, right? Which is really dangerous, right? I was, it was classed as an emergency. But I had actually been living that with quite a while, but nobody would listen to me. And what happened was I mentioned, because I had, it was like this person I went to, it was a series. I went for a year, right, and I was going to get, it was like a series of treatments to support me. And when I mentioned about my eye, this person had said that, I'm going to see if there's, because what happened at the time was there was a bit of a panic, and then there was the medical system saying, I don't think we can do anything for you. I think you're going to lose your eye now. I was a young woman, and like any young woman, I was obviously fearful at some level of losing my eye. Now, in my head, I kept saying, no, I'm not going to lose this. I'm going to do everything. And up to this point, anyway, I did at least it was usually about 2 hours of meditation a day. And I'd done lots of always imagine my body healing. I'd done that every day. And I thought I'm going to find a solution. They said there was no solution to the problem. And they had explained that it was normally this type of, there was quite a lot of things going on in the back of the eye, and a lot of rare things. But what they would say, these typical things were when someone was in a major traumatic accident, a car accident or something, and the eye was impacted. And so there was a lot of things said to me in relation to, there's nothing we can do at the moment, we're just going to have to monitor, but you really have to be careful. And if you think this, you have to come emergency right away and all this, right? So this guy, even though, and I don't know, to be honest, I'm trying to remember, did the hypnosis incident happen before this or after? I can't remember, but whatever happened, this guy had persuaded me he was going to contact some doctors in America and some other people to see if there was anything they could do to support the healing of the eye, and to even maybe nutritionally. I was, understood how important nutrition was and how nutrition can help support a lot of things in the body that's going on. And I knew I also had, I had a history of gut issues. I knew there was issues to do with connective tissue and things like that. And he came back with a product and had said to me he'd really done his homework on it and said that it was really safe, but anything that he'd read, and he spoke to these doctors and these specialists, and this could really, really support me, right, and support my eye. Right. So, and I remember saying to him, and are you sure it's this, is this condition? Yeah, I've checked everything. And stupid me takes the product, and basically the product is, I think it was, if I'm remembering correctly, it was partly aloe vera and something else. And so it was quite what we call hypertonic. It was a lot of aqueous and water in it. Now, I wasn't really thinking, and I didn't really understand at this point, because I hadn't, later I would get, there was a new piece of equipment came to Scotland that eventually I was so there was more information came out about the condition. But he told me to put these drops in my eye. Now, thank God, this happened. So I would always go to him on a Saturday. And I was to see the specialist. I was seeing the specialist weekly at this point to monitor the eye. I was seeing the specialist on the Monday. And I took the drops and I put them in my eye. When I got to the specialist on a Monday, my eye was already 2, it went down to 1. Now that, and he went mental. He knew something had wrong because it was often 2, but sometimes it would, I think 3, 4 something, but it was 2, was already really dangerous. And he went through the roof. Asked me what I'd done. Was there anything going on? I explained what I'd done. And rightly so, he, really gave me a hard time and said, you're lucky you've still got your eye. And, obviously I never used them again. When I went back to that practitioner, and this was the shocker, the practitioner said to me, oh, I didn't believe what you said because I couldn't find that condition. And I did see something related, but it wasn't related to somebody your age. So I thought it was, and I think what he said, I had extreme low intraocular pressure and that I would fill up with water. And he assumed I had the opposite glaucoma because glaucoma is more, how could you say, well known, right? So he made an assumption. He did not listen. He did not believe what I said, and he jumped to conclusions, potentially very harmful conclusions. Now that's only a tiny thing of some of the things that happened, but it made me recognise about how important listening is and not jump to conclusion, and also knowing where your wisdom lies where it doesn't, and always recognising that you don't know what you don't know. There's always things that you'll learn, and you'll as you evolve as a healer or practitioner. So the first thing is, I think the main thing is presence and compassion, and having the awareness that you don't always know, and even what you've been taught as a therapist or a healer may not be the full picture, and it may not be based in truth. I'm 36, 37 down near the line studying all sorts of things, and a lot of things that I was taught very early on I disagree with now, and I know it wasn't based on truth. And it's like the same as, I've had a lot of really rare medical conditions, and doctors and specialists have actually said to me, you are actually evidence that a lot of things that are taught in the medical system are wrong and based not on truth, because your particular circumstances actually show the gaps and show where we've got things wrong. And he says, and that's why, and I remember when doctors saying to me, that's why people will be triggered by you, a lot of things to do with medical conditions, because you actually highlight some of the things that we've made presumptions about that weren't right. So, and that can happen in, healing and therapy and coaching. If you care about your clients and your patients, you should want to come from compassion first, right? And if someone has had a lot of gaslighting, had a lot of trauma, they've not been believed. They've not been listened to. They've been treated, sometimes appallingly, and I've not included some of the really, I've not shared the appalling experiences, but one of the things is that, think about it from a human perspective of just being, sometimes people just need to be heard and listened to, and have that safe space to know that you actually genuinely care, right? And just having opinion, or it's like I spent years, helping. One area of my business was helping other holistic business owners, and one of the interesting things that used to happen, doesn't happen as much now, but it still does happen a bit, is that I would go on help the business owner, and they would have maybe read a blog or read something about me, and the next thing would be projecting onto me what was wrong with me in their opinion and what I should be doing, even though I didn't ask. I don't really want. They would be pushing their boundaries, projecting their energy onto, projecting their opinion. And what they didn't know was sometimes that happened to me how many times in a day with different people. It was not healthy. It was not helpful. And, and if you think about, if any of these have actually, the Celestine prophecy, and you talk about how people's energy and the need to control or the need to kind of overpower you. A lot of times it felt like people were trying to overpower me, or because they were so invested in their modality, they were trying to push their modality onto me, and that happened a lot. And it would push me the opposite way. It would make me want to shut down, because they weren't meeting me with compassion. They weren't meeting me with non-judgment. They weren't meeting me with presence. They were often sometimes projecting their also bias, because the things that was said was unbelievable, because they didn't learn about my story, really. But they would project their own bias, their own judgment, and it just felt as if it was like I was getting things dumped on me. So remember, we all want to be met with compassion. We all want to be listened to, right? We all want to be treated with respect and care. And it starts by listening. I hope you've enjoyed this video. And if you are a healer, a practitioner, a coach, and you would love to learn more about your own gifts, unlock more about even some of your, what I call your superpowers, and even would like to explore the subject of more deeper awareness, I have a free webinar coming up. There will be a recording, but if you can manage the live, you'll get far more out of it, because you'll be able to interact with me, and I will be helping most of you try and capture and understand more of the gifts that you have that maybe you're not owning or not seeing. Okay, so I'll put that, and I'll put some other free resources with this video. Have a wonderful day. Thank you for listening. Bye bye.